Hey everyone, welcome to another episode of Ask Dr. J, and today we're going to talk about the difference between aligner therapy and conventional braces. So, and by the way, we'll break that down. Aligner therapy could be Invisalign, it could be SureSmile, which we use in our office. We have used Invisalign as well, and Smile Direct is one that you may have heard of. Aligner therapy also is usually guided by a dentist. Smile Direct for a while was done on your own at home. So that's an important thing to understand the difference of. And then braces, there's all kinds of braces, metal braces, there is ceramic braces, there's braces called lingual braces, or ones that go on the inside. So let's talk about all these things and what they mean and some of the indications for certain situations. So aligners, SureSmile in our office. It's a great way to move your teeth and not have to walk around with all that hardware in your mouth, outside of the teeth or inside. And we can do a lot with them. I would tell you that conventional bracketed orthodontics, there still is more control, and usually it is a faster process. But today, with aligner and the attachments that we use, we can do a lot of different treatments. So it's a phenomenal option. You can take them in and out, which is a plus, and it's a minus. So compliance for aligners is really important. If you're not wearing them, we say 23 hours a day, so that means really wearing them all the time except for when you're eating and taking them out to clean. I tell people if they're gonna go out to an event, leave them home so you don't lose them. But wearing them definitely for the majority of the day makes a difference. What happens if you don't? Well, either your treatment's gonna take a lot longer, and this is pretty typical because not everyone's gonna wear them 23 hours a day, or you can start to get off track. So we always talk about, are you tracking? You'll hear your dentist say that. Are you tracking when you're in aligners? That means, are the teeth moving according to the plan that has been laid out digitally or however it's done? So aligners. And in fact, I was making this decision for my 13-year-old, and we decided to go aligners. I was a little bit concerned about his compliance. He's 13, but he's doing a phenomenal job. And the reason I chose that is because with brackets, it's harder to clean around your teeth. And he does have inherently and genetically a higher risk of getting cavities. And on top of that, he's got a sweet tooth like his dad. So we chose aligners because it was going to be easier for him to clean the teeth, and also there'd be less risk of cavities and damage to the teeth down the road. How's it turning out? He's actually doing a phenomenal job, because for him, it's every week and a half, 2 weeks, he gets to the goal. So if you can look at it that way and you can get through it each step at a time, and you're that type of person, you have discipline, it's a phenomenal option. So brackets. Yes, we can do more movements with brackets. Maybe if we're opening up a space for an implant where the teeth have collapsed, or if there's a severe underbite where the lower jaw is outside here. If you're somebody that needs jaw surgery, then we have to basically move the teeth backwards. In other words, they're gonna look worse before they get better using brackets. It's very heavy movements, and then the whole jaw is moved and corrected. And so brackets, definitely we have more flexibility of what we can do. There's also, you can use implants to anchor the brackets off of to get more movement or more force. So brackets are a great option as well. We talked about outside brackets versus inside brackets. So I understand why you would not want the brackets to be on the outside, but the patients that I've seen that have had brackets on the inside of their teeth, it's really usually been a nightmare. What I mean by that, it's uncomfortable for your tongue, it's hard to eat. Usually people with brackets on the outside eventually get used to it. Until the end, you want to get them off, because they know it is a lot of hardware in your mouth. But again, the inside brackets, they have the aesthetic benefit, but they're really not the most comfortable. And there's some people that do it and do it well. Ceramic brackets. So that's something that can be used. Maybe you are coming into a wedding and you have braces and you want to be able to take pictures and really have minimal show of the braces, but you're not a candidate for aligner therapy because of the severity of the movement. Then you can have ceramic brackets that really blend in nice with the teeth. They actually match the color of your teeth. So all kinds of brackets, all kinds of aligners, they both do a great job. And they both have special times when they should or should not be used, as we just talked about. Let's talk about age as well. So normally I do like children to have brackets because of that whole discipline factor. A lot of times the aligners get lost, even us adults lose them. So for kids to keep track of that along with their schoolwork and their activities can be difficult. And also the treatment usually goes faster in brackets. Again, I mentioned my son, why I chose that. So there is specific indications where children would use aligners, and it's a good treatment. You can also, with aligners, phase them. In other words, you can use them in the beginning when the front teeth come in to straighten them out. That may give your child some more confidence socially. Maybe they're not being picked on. I know that we have to talk about these things, but it's true. And then they can come into a second phase. And you can do the same with brackets, but there's more because you have to put them on, take them off, wait, wear a retainer, put them on, take them off. So again, for children, usually the brackets is a better way to go, again, because of that compliance and discipline. Adults, we usually do more aligner therapy. Adults are busy. They typically don't want, especially if you've been through braces before, you don't want to go through them again. So if you can have the discipline, aligners work great. And again, there's a lot we can do. The only time that you may require braces as an adult, I had a patient, a 70-year-old ophthalmologist that we did a full mouth rehabilitation on. The movement was pretty significant, where his teeth were worn and we had to create space and move the teeth into the jaw. So that was going to take him 3 to 4 years with aligners and a year and a half with braces. So for him, he chose to do the braces so that we could get to the rehabilitation with his crowns and veneers. So again, a lot of information here. I know there's a lot to it. Hopefully that this was helpful so that when you're up against this decision, you have your options. And also, it's important that you rely on what your dentist is telling you on which option may be better suited for you. Just make sure that you get the pluses and the minuses for each one of those. Again, thank you for tuning into another episode of Ask Dr. J, and I hope this provides some clarity on the difference between conventional braces or brackets and aligner therapy. Have a phenomenal day.